I'm Barbara Yawn. I'm a physician and the Director of Research at the Olmsted Medical Center. And today we're going to talk a little bit about an article that's coming out in the Mayo Clinic Proceedings, Herpes Zoster, Eye Complications, Rates and Trends. Now, this study was done in the Olmsted County population, and as many people know, we have something called the Rochester Epidemiology Project, and that allows us to link data from all of the healthcare clinics in Olmsted County. So when we talk about population-based, we really mean the whole population, anybody who seeks medical care at any of the sites. And we believe that's about 98% of all the individuals who live in Olmsted County. So this study looked at all of the people who had herpes zoster or shingles from 1980 to 2011 in this community. We had about 2,000 confirmed cases, 2,035 to be exact, and looked at the medical records for every one of these cases to identify eye complications, not just herpes zoster ophthalmicus, which means that it is in that nerve branch, but doesn't necessarily have eye complications. And what we found was there were 189 episodes of eye complications in 184 people. There were some people who had more than one episode, and we've talked about recurrent zoster in another paper I wrote, also in the Mayo Clinic Proceedings. So we have 189 cases in 185 individuals. That's about 9% of all episodes of herpes zoster result in eye complications. I think it's really important to make that distinction between eye complications and herpes zoster ophthalmicus, and I hope in the future when people write papers, they'll write herpes zoster ophthalmicus eye complications to make it very clear the distinction. So what did we find for the types of eye complications? Well, overall, the average age of the people with eye complications was about 62 years. We had 4 cases of eye complications in individuals with herpes zoster less than age 21. Almost all of those individuals had some major immunosuppressing condition. Of the eye complications, we had conjunctivitis and this is only conjunctivitis, in about a third. Keratitis occurred in about 76%, and uveitis, iritis in 47%. So you can see they go down from keratitis to the uveitis, iritis, down to the conjunctivitis. Now, many of the people who had keratitis or the iritis also had conjunctivitis, but it was one of the diagnoses. Of the individuals who had the keratitis and uveitis, a number of those had symptoms that didn't occur immediately. And I think that's an important take-home point, that some of these individuals came in and were referred to ophthalmologists for possible eye complications. When they were seen immediately, they didn't have any eye problems. But 3 to 7 days later, they came back complaining of a red eye or eye pain. So anytime you have someone that has herpes zoster ophthalmicus and they don't immediately have an identifiable eye complication, you want to tell them, be sure if you start having a red eye or pain, come back immediately, because these can develop a little bit later in the course. There were also people who had recurrent keratitis and recurrent uveitis and iritis. Those people usually had it anywhere from 2 to 6 months after the first episode cleared up, which would clear up in 3 to 4 weeks. Then there'd be a period with no problems, and they would then have a recurrent episode and again require treatment. obviously these people had a lot of healthcare utilization, and I think that's important to realize that over a third of them had healthcare utilization lasting longer than a year. So it may not have been very frequent toward the end, but they still had to be followed to make sure. About 6% of them had permanent visual loss or significant impairment. So 6 of them had new vision problems that were 20/200 or worse. There were another 6 individuals, the other 3%, who had either unilateral blindness or scarring significant enough to impair vision, or had loss of the use of the muscles in the eyelid, so that they had to have actually a permanent closure of the eyelid. So a total of 6% with permanent vision loss and significant vision loss. So herpes zoster with eye complications is common. Eye complications about 9%. Of that 9%, about 6% had permanent vision loss. The trends over time did not show any increased rate of eye complications among those with herpes zoster. Now, the rates of herpes zoster have been increasing, and over this period of time just about doubled, but in those that had herpes zoster, the 9% rate of eye complications was steady, and the ratios of the iritis to the keratitis to the conjunctivitis were also stable. So that's all good news for us. But I think it's important to realize that we do have something that we can do to prevent the zoster. If we prevent the zoster, then we ought to be able to prevent the eye complications too. So we need to think about the use of prevention in all of our patients, and right now that's with a vaccine for patients over the age of 50. So remember, check to see if there's eye complications. If there aren't acute, tell the patients about new onset pain or redness and they need to come back. Don't forget there are recurrences of these problems even after they seem to have quieted down, and that prevention may be possible.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.